Hello, everyone. My name is Ann Cleveland, and I am a paralegal at Lyles Parker. Welcome to today's webinar hosted by the Texas Association for Home Care and Hospice. Today's webinar is entitled COVID-19 Vaccination Mandates and Mask Mandates Updates. Today's presenter is Heidi Coker. Jennifer Papapaneotu, unfortunately, will not be able to join us today. Heidi Coker, Esquire, MBA, CHC, is a partner with the law firm. She has over 20 years of experience advising and defending healthcare clients on legal and regulatory matters affecting providers of all sizes. She is an expert in all aspects of compliance and privacy programs, including developing and deploying policies, procedures, and training. Her experience includes serving as Chief Compliance Officer and Chief Privacy Officer, implementing the various requirements and aspects of corporate integrity agreements, and responding to and defending audits from Medicare, Medicaid, and private insurers up to the ALJ level. She received her JD from Georgetown University Law Center, and she is licensed in Texas and Maryland, and she is certified in healthcare compliance. And now, without further ado, I present our speaker, Heidi Coker.
Thank you so much, Ann. Happy New Year to everybody participating in today's call. Looking forward to giving you some updates as to what is going on with the COVID-19 vaccination mandates and mask mandates. I think this is sort of a perennial topic. I double-checked the other day, actually last night, on websites, and there's still a fair number of COVID cases out there. And still, over 300 people dying every day from COVID. So we figured this was an appropriate topic for the beginning of the year. Next slide, please. We do have to do, obviously, our disclaimer and let you know that this information is general educational information and does not constitute legal advice. It should not be used as a substitute for seeking your own legal counsel. Outcomes can and do differ depending on specific facts. Next slide, please. So as said, there's still a fair amount of stuff going on with the COVID-19 vaccinations. There still are quite a few cases. We're coming into the worst of the winter season. We've got flu and RSV out there, and I actually was speaking with a provider around Christmas time, and he was telling me that yes, he works in an urgent care center, and he said it's amazing how many people are coming in with double or triple illnesses all at the same time, or they're coming in with sequential illnesses. They'll get flu and then COVID, or in children, they'll get COVID and then RSV. So there's still a lot of illness going out there. And again, as the weather gets colder, people are going to be indoors more, and they're going to be, because they're indoors, in much closer communication, spreading all these diseases. So with that as the background, we're going to go ahead and plunge into what the status is. And really, in some ways, there haven't been many changes, and in some ways, there have been changes. So it's kind of interesting to go through and prep for this webinar. So where we're going to start is we're going to start with the federal regulations, because we have made the assumptions that most of you do have Medicare certifications, and so we want to make sure that we covered this. So we're going to start with the CMS COVID-19 interim final rule, and this was published early last year. It was on January 20th of 2022, so not quite a year old. And the purpose of this was to sort of collate all of the different instructions and guidelines that had been put out by CMS since the start of the pandemic. So the purpose is to, again, establish and discuss what the vaccination requirement is for most Medicare providers, with the objective of protecting the health and safety of individuals providing care and services to Medicare beneficiaries, and also those beneficiaries who are receiving care from Medicare and Medicaid certified providers and suppliers. One thing to note about all of this is CMS considers compliance with these vaccine rules a condition of participation rather than a condition of payment. So that's something very important. And as we'll talk about in a little bit, it can come up in your surveys. This CMS interim final rule is a federal rule, and again, it's going to preempt any state law that conflicts, which is going to be particularly interesting in Texas. So there's a link here to the document as well as the updates that were made to the Medicare manuals. There are slightly different updates for different kinds of providers, and they have specific attachments in this interim final rule for both hospice and home health. They're essentially identical, but they do differ from some other provider types. So do make sure you take a look at those. So the effective dates in Texas, and these dates occurred after there were various court cases and injunctions, and then ultimately the dismissal of a Texas case. So there was a February 22nd, 2022 deadline for policies and procedures to be developed and implemented, and all staff to have received the first dose of the 2 vaccine series. So that's either the Moderna or the Pfizer vaccines. And then a March 21st, 2022 deadline for the second dose if you have a 2-dose vaccine series or the first dose vaccine, which at this point is Johnson & Johnson. Interestingly enough, these rules apply only to the primary vaccine series, so the first 2 vaccines, and do not apply to boosters, which is, I think, very interesting. Next slide, please. So let's talk about who in your agency has to be certified, or excuse me, vaccinated. So all eligible staff, both current and new, working at a facility or directly with patients, regardless of the patient responsibility or patient contact. So this again includes any facility employees. So if you are, for example, a hospice facility and you have somebody who doesn't have patient contact but is working at the facility, so maybe somebody in the back office, they have to be vaccinated. Any licensed practitioners, students, trainees, volunteers, contracted staff. So if you have, for example, contracted PT or OT coming in, those individuals have to be vaccinated. Then staff who perform duties off-site and contact with the patient. So for example, if you're doing home infusion therapy or you have home health staff, those individuals have to be vaccinated. And any individuals who enter a CMS regulated facility. So if you are providing services, for example, to a SNF, then those individuals who go in need to be vaccinated. The vaccination rule does not apply to full-time telework staff. So if you have somebody who is off-site and is only working remotely, they do not need to be vaccinated. And it also does not apply to infrequent, what they call one-off vendors, volunteers, or professionals. And what you need to look at here is consider the frequency of the presence, the services provided, and the proximity to the patients. So examples of the one-off volunteers or vendors would be somebody like, for example, your elevator service technician comes in to do the annual inspection and preventive maintenance on an elevator. Those people don't need to be vaccinated. You know, if you've got lawn services, they're outside, they really don't have patient contact, those probably don't need to be vaccinated as well. So those are the kinds of balance factors and balancing tests you want to apply in determining who needs to be vaccinated. Next slide, please. So the rule does have a record keeping requirement, and this is something that the surveyors will look for. You need to make sure you have record of each staff member's max vaccination status, and that has to include what is the specific vaccine they received. So you have to note if it's the Pfizer, the Moderna, or the Johnson & Johnson, the dates of each dose, the date of the next scheduled dose if your series is not completed. So again, if you have somebody who, for whatever reason, has only received one dose of a 2-dose series, you have to note when the second dose is required and then follow up and make sure that that second dose is required. You have to keep the same information on any booster doses. But again, boosters at this point are not required by CMS. You need to identify each person's staffing role, the assigned work area, and if they interact with patients, how that happens. So again, this is all to help determine whether or not the vaccine rule applies to them. Your record keeping must include any requests for exemptions, along with any required medical documentation, and the decisions made as to those exemption requests and what accommodations you may have granted. You also have to keep track of the staff for whom vaccination must be temporarily delayed and when the identified staff can resume vaccination. So for example, if somebody had the first dose and then got sick with COVID, there's a waiting period before you can get the second dose. So you have to keep track of that as well. And again, follow up and make sure that that staff member got their second dose. And you also have to keep track of the staff who exclusively telework or work remotely, not in the facility, again, so that you know who the vaccine requirements apply to. Next slide, please. As with many of these things, there are exemptions. Individuals can request either a medical exemption or a religious exemption, and there are some requirements for both of these. So for the medical exemption, you have to have a written agency policy. Again, you can't just do this one-off off the top of your head. You must have a written policy. And you have required documentation from the employee, such as why all vaccines are clinically contraindicated or should be delayed. And then the documentation from the employee must actually be signed by the employee's healthcare practitioner, and it includes a specific statement recommending exemption. The standard for an accommodation under a medical exemption is an undue burden. In other words, does the proposed accommodation require a quote-unquote significant difficulty or expense for the employer? So for example, if you have, let's say, a hospice nurse who goes into the patient's homes, she has a medical reason for not being vaccinated, and she requests an exemption, and she says, I just don't want to go into patient homes anymore. Well, is that, an undue burden? Can you move her to another job? You need to sort of evaluate all of these things, and we'll talk about these on the next slide. For the religious exemption, again, you have to have a written policy, and the documentation from the employee is identification of what the sincerely held religious beliefs, practices, and observances are. And we'll talk a little bit about what sincerely held is. Actually, I may as well go ahead and do that now. But you can inquire as to whether these are sincerely held religious beliefs, and there is some documentation that you can request about that. Again, the standard for accommodation for a religious exemption is undue burden, and here it's a little bit different. Here, the EEOC is going to ask whether the proposed accommodation poses more than a de minimis cost or burden to the employer. So, you're going to look at those kinds of things again. And again, these are going to be case-by-case basis looked at, and the documentation that you're going to have held in your files that will be requested and looked into by the regulators. Next slide, please. So some of the exemptions for medical reasons are actually specifically recognized by the CDC. So some of the recognized contraindications are an allergic reaction to the previous vaccine or one of its components, or any other recognized clinical contraindication that has been identified by the CDC in its summary document for interim clinical considerations. And we've put the link here in the slide. So again, just because somebody says they have a reason for a medical exemption is not good enough. They have to document it. And again, go and look at the CDC document with the contraindications and then work that way. And as I said earlier, the CDC does recommend a temporary delay in getting either the first or the second COVID vaccination if there is acute illness secondary to a COVID infection. And the other thing we're going to put out here is, again, this is CMS, but you're going to have the EEOC looking on here. So what you want to look at is the Americans with Disabilities Act and EEOC guidance on accommodations for disabilities. We have people out there saying that the reason that they can't get a vaccination amounts to a disability, and you know, that they're trying to get a disability on top of that. So make sure you are very cautious about these things, both vis-a-vis the employee and vis-a-vis what the reasons are for exemption, because this quickly gets very, very sticky. Next slide. For religious exemptions, the CMS is saying you should review the EEOC compliance manual on religious discrimination, and this is to help develop your policy and process and how to evaluate your requests. The link for that compliance manual is there. The EEOC has also issued specific FAQs and guidance on COVID-19, the Americans with Disabilities Act, the Rehabilitation Act, and other equal employment opportunity laws. And we've put the link in for there. One of the things to remember is, again, on the prior slide, is that you can actually do some inquiry into what the sincerely held religious beliefs are here. And I'm just going to quickly highlight verbally some of these that are in the EEOC compliance manual. So they can ask, for example, a statement or a document from the individual claiming the exemption to describe his or her beliefs or practices. And that can include information about how the individual has embraced the belief, the observance, or the practice, as well as when, where, and how the individual has adhered to that belief or practice. And you can also get statements or other documents from other individuals. So for example, if there's a question and the individual says, oh, my pastor recommends, you know, for religious reasons, we don't do this. Well, then you can actually get information from the pastor or other religious leader. The individual can also provide documentation from other members of that faith. And you can get information from friends, neighbors, managers, or even coworkers who may know if somebody has actually in the past taken steps to demonstrate that adherence to the belief. So employers can also ask these questions. And again, just remember, you have to have an objective basis for asking these. You can't ask about people's religious beliefs without there being a good reason to do so. But if you're trying to process an exemption from the vaccination requirements due to religious beliefs, then those are the kinds of things you can do. Next slide, please. So the way CMS is going to see if people have adhered to this interim final rule is through the survey process, and they have actually issued survey guidance to the surveyors about how to look at this. So again, the facility policy or the entity policy has to ensure that those who are not yet fully vaccinated or who have been granted an exemption or accommodation or who have a temporary delay in reaching full vaccination status adhere to what they calling additional precautions. And again, the objective of these is to make sure that COVID doesn't spread any further. So some of the examples of steps that you can take to mitigate these issues are the following. So you can reassign staff to non-patient care areas to duties that can be performed remotely, like telework, or duties which limit exposure to those who are most at risk. So for example, if you have an individual like a home health nurse who is out in the field, maybe you can assign that individual to patients who are not immunocompromised or patients who are vaccinated. You can require staff to follow additional CDC precautions, such as making sure you strictly adhere to universal source control and physical distancing in areas that are restricted from patient access. So, for example, in your staff meeting rooms and your kitchen, make sure you have the sufficient spacing and so on. And this applies even if the facility or service site is located in a county with low to moderate community transmission rates. You can require weekly testing for those staff until the regulatory requirements are met, regardless of where the facility is. And you can also require following CDC recommendations for testing whether or not you're in, you can follow CDC recommendations for testing unvaccinated staff in counties with substantial to high community transmission. So that might be, again, at least weekly testing, perhaps twice weekly testing, double masking. I mean, who knows? There are other things that you can do if you are in a high transmission county. And again, you're going to be needing to follow either your state health department or the CDC or your county health department information to determine whether or not you have substantial to high community transmission. You can have those staff who are unvaccinated use a NIOSH-approved N95 or equivalent or higher respirator for control of the infection source, regardless of whether they are providing direct care or otherwise interacting with patients. So in this circumstance, you can actually basically have a mask mandate. And one thing to note here is the cost of the accommodation is paid for by the employer, not the individual. So again, these are the kinds of things that CMS is going to be looking for. Next slide, please. So again, enforcement is going to be through the survey process. These questions will be asked in the initial survey, any recertification surveys, such as through a state agency or accreditation, and complaint surveys if these complaints are related to staff vaccination requirements. In this guidance document where we posted the link earlier, CMS has indicated there and in other documentation multiple times that 100% compliance is expected with these vaccination requirements. And again, remember, it's not boosters, it's just the initial 2-dose series. So they're going to look at 3 requirements in the survey process. Number 1, the process or plan for vaccinating all eligible staff. Secondly, the process or plan for providing exemptions or accommodations for those who are exempt. And third, the process or plan for tracking and documenting staff vaccinations. So this is pretty important. Again, remember we talked about having a policy and a procedure, but this here is going to put the onus on you all as agency owners and managers to track this on an ongoing basis to make sure that you have sufficient documentation to prove in a survey situation that you know the status of all your staff. So as part of this, what they're going to do, the surveyors will review a sample of the staff, and they're going to look at both vaccinated and unvaccinated staff. They're going to look at the documentation for all medical exemptions that have been requested and granted. And they may be interviewing and observing unvaccinated staff, because again, remember, according to the prior slide, you can require those unvaccinated staff to use an N95 or higher respirator. So they're going to be looking to see if the staff that are unvaccinated are in fact using the N95s. They're going to look at whether or not there is what they're calling egregious non-compliance. And egregious non-compliance is essentially defined as complete disregard for the requirements. And those are going to receive condition level deficiencies in the survey. So examples of egregious non-compliance are things like more than 50% of the staff is not vaccinated unless those unvaccinated staff are exempted or temporarily delayed, or your policies and procedures are not implemented as required. So again, a fair amount of onus on making sure that you have a defined policy, a written policy beforehand, and then that you have the documentation that you are properly implementing that policy. As we lawyers always say, if it's not documented, it didn't happen. So make sure you're staying up with the ongoing documentation to make sure that you can demonstrate compliance with the CMS rules. Next slide, please. So as part of the enforcement, again, there may issue plans of correction. And if you are cited, your plan of correction must demonstrate what CMS is calling a good faith effort to correct the noncompliance. And some of these examples include things like if access to vaccines is limited. So for example, if you provide services or you're located in a very rural area, you have to document that you have made attempts to obtain vaccine access, such as contact with health departments or pharmacies. If the facility provides evidence of aggressive steps to have the staff vaccinated, that's another example of good faith effort. So examples of what those aggressive steps might be include advertising for new staff and saying, this is our vaccine policy, hosting vaccine clinics. So as an example, if the plan of correction ends up demonstrating that after the survey, more than 90% of the facility staff is vaccinated and all the policies and procedures were developed and implemented, this is then a good faith effort and the deficiency is cleared and the facility or the entity is then returned to substantial compliance. So there's a lot of stuff down here in the weeds where you need to make sure that your T's are crossed and your I's are dotted. And again, here's the link again for the CMS rule. Make sure you download it, make sure you read it, make sure you understand it, and when you get to your kind of facility, either be it hospice or home health, go through the attachment specific to your provider type and then tick through it and make sure that you comply with all of these things. All right, next slide, please. So one question that always comes up is, what if we are not a Medicare certified agency, then how does this apply? Well, if your agency is licensed only by the state or you're licensed and you are PAS only, then the CMS vaccine mandate rule doesn't apply to you, right? Because you're not Medicare certified and you're not getting federal funds. So in that case, you default to the Texas state rules, which we will be, well, Texas really doesn't have any state rules. That's pretty much where we're at with the Texas situation. If you operate side by side, so in other words, separately licensed home health hospice operations, PAS operations, and then LCHHS agencies, such as licensed and certified, under the same or different legal entities, there is a process for determining what rules apply. So where you're going to look is this Texas Health and Human Services Determination of Separate Entities letter. It dates from 2017, but it is still in force, and we put the link here for you. And here, CMS is going to look at the operation of the agency, what the consumer awareness is, what the staff awareness is, and then the details of how the agency actually operates. They're going to look to see if you have separate or combined client records, staff and employee records, and financial records. They're going to look at the public-facing brochures, websites, phone listings, advertisements, and so on. If you want to, again, get the exemption for the non-licensed side or the PAS side, then your documentation here, the public-facing information, should emphasize the separateness of these two faces. And the staff should really understand which entity or which side they work for, what the differences are in the two entities, and what the regulatory requirements are for their specific role. So again, if you only have somebody providing personal attendant services, they should really clearly understand what the personal attendant services are and how those differ from perhaps the home health services and so on. You really want to make sure you do sufficient training and education with your staff to clarify this. If the staff divides time between the licensed and certified side and another agency, so again, you've got staff that does both home health and perhaps personal attendant services, well, those staff are going to be subjected to the CMS vaccine mandate. And if you think about it, this makes sense. Again, if they're providing services to a Medicare beneficiary, they have to comply with the CMS rule. So again, be very, very diligent about making sure that your staff understand who they work for and what the circumstances are. All right, so that kind of handles the vaccine requirements. Again, Texas in and of itself does not have a vaccine mandate. So really much of this is going to apply to if you are getting Medicare or Medicaid. And again, we have made the assumption that many of you are in fact getting Medicare or Medicaid dollars. Next slide, please. We're going to turn now to the mask mandates. And again, remember that the mask mandates are a little bit more generic than the vaccine mandates. Again, the vaccine mandates, the CMS one in particular, arose in the context of providing care to patients, right? Whereas the mask mandates were often, at least initially, pitched more as sort of applying to anybody and everybody and applying to, all kinds of circumstances, not just healthcare providers and not just healthcare settings. So the mask mandates were initially much more generic. And over the last, almost 2 years now, Um, there have been multiple orders by the governor. And so what finally happened is they finally created a combo order, GA 38, and this sort of summarizes and collates and brings up to date all of the previous orders that were issued by the governor. And I believe if you click on that link there, the Texas Governor's Executive Order, it will actually take you to the text of the order. So what this executive order now does is it prohibits governmental entities from requiring any person to wear a face covering or mask, or mandating that another person wear a face covering. So this is going to apply again to governmental entities. What are those? A county, a city, a school district, or a public health authority. So no city or county level public health authority can mandate that anybody wears a mask. And what this executive order further did, 38, is it updated it. And what had been the case was that in areas where you had high hospitalizations, the local public health authority or the county could require individuals in those areas to wear masks. Well, GA 38 removed the ability to require masks even if there are areas of high hospitalization. So there has been, oops, go back please. Yeah, there has been extensive litigation on these mask mandates at both the state and the federal level, and you have warring lawsuits about that. The Fifth Circuit, which is federal court, removed an injunction that the district court had implemented that stopped the implementation of Executive Order GA 38. So at the federal level, the Fifth Circuit has said GA 38 is in place, which says no mask mandate. There is currently an appeal pending at the Texas Supreme Court, and not just Abbott versus City of San Antonio, but State of Texas versus San Antonio Independent School District. And the situation here, we're still waiting responses to the petition are due later on this month. But most state appellate courts at this state level have ruled against the governor in terms of GA 38. One did not. And of course, the governor's administration has appealed this to the Texas Supreme Court. So this is ongoing. So we shall see where this goes. So this is very much still up in the air as to where ultimately we will land with the mask mandates. As of right now, again, federally, there is no mask mandate based on the Fifth Circuit. At the state level, most state courts have said this executive order cannot be in place, although one did not. Now, there are some exemptions in the executive order, and so you've got state living centers, government hospitals, the corrections facilities, and the juvenile justice facilities, and county and municipal jails can continue to implement policies regarding masks. And again, these are cases of very high density congregate living, and so the governor's order actually exempted those. So again, if you're providing services in any of these settings, be aware that they can require masks. Next slide, please. So the interesting thing is that private businesses still have the right to require masks for customers and employees. So as a private employer, if you so desire, you can require mask wearing. But your state and local government entities can no longer require mask wearing. One of the things is with requiring masks, again, there's always the caveat about you can't discriminate against a protected class, race, color, religion, national origin, or disability or marital status. So as long as you implement and enforce a mask requirement against everybody, you can still require that. According to the EEOC, again, because this is one of the entities that we look towards, yes, an employer can require employees to wear not just face coverings, but also gloves. And again, employees can make a request for reasonable accommodation under either the Americans with Disabilities Act or religious accommodations under the Civil Rights Act. So, for example, the individual can request to wear a modified mask so that they can wear it with their religious head covering. And again, the discussion that we had earlier about some of these things with the exemptions is going to apply here as well with the mask mandates. So employers, once you go through the process, you should provide the modification or accommodation unless it creates an undue hardship standard. And again, this undue hardship standard for the masks is the same as the standards that we discussed earlier under the medical and the religious exemptions. Again, here is the link to the FAQs about these circumstances, about these masks and the other EEOC laws, where you can get more information about that. That's our presentation. Again, lots of changes in some ways and very few changes in other ways. I think where we're going to be really looking is to see how the state court cases come out. I don't anticipate that there is going to be an appeal of the Fifth Circuit case. It gets very expensive, and I don't think people want to have the Supreme Court opine on some of these cases. So again, at the federal level, some of the mask wearing mandates have been resolved. We still have questions at the state levels. But again, since you are private employers, most of you, if you are private employers, you can require masks. I'm going to go ahead and open it up to questions.
Yeah, Heidi, we've got a question from the text box. If you're ready.
Sure.
All right. The question is, does this vaccination requirement apply to agencies that are not licensed CMS agencies, such as agencies which are only PAS or private pay, non-medical home care agencies?
So the vaccine requirement does not apply to private pay or PAS only agencies. Only if you're Medicare certified and you get Medicare or Medicaid dollars does the vaccine requirement apply.
Perfect. Thanks, Heidi. We have another question from someone else that just asks more generally, what about OSHA requirements?
That's a good question. OSHA is going to obviously be looking at infection control. We did not specifically address OSHA requirements in this one. We really just kind of focused really more on the CMS requirements. If that individual wants to reach out separately, we can discuss what those are.
Perfect. Thanks, Heidi. Here is another one that asks, can we hire a PAS attendant who is waiting for her second vaccination, or are we supposed to wait until both doses have been done? Thank you.
You can definitely hire somebody who has had only their first vaccination, but you need to track and make sure that that individual then gets the second vaccination in the 2 vaccination series. And again, this is only for the primary series, your first 2 vaccinations. This does not apply to boosters. So just want to clarify and make sure that we're talking about the first 2 vaccinations and not the boosters. And yeah, and the other thing is, again, if they're PAS, look at, are you PAS only? Because again, then the vaccine requirements do not apply to you at all. So you have to ask, first of all, what is the status of the agency, and then look at the individual.
Thanks so much, Heidi. We have a couple more questions. One viewer asked, do these mandates apply to social workers?
Assuming the social workers is going to have contact with patients, then yes, it will apply to social workers. It applies to all employees, unless they're doing something like telework, or are, again, infrequent or one-off. So again, you're going to ask the question, I'm assuming that this social worker works for an agency that gets Medicare or Medicaid. So if that's yes, then the social worker, yes, must apply if they have contact with patients or they're on site.
Gotcha. Thank you, Heidi. We have a couple more questions sort of in the same vein. Someone's asking if these mandates apply to sales and marketing teams. And then someone else asked, do these mandates apply to LHH pediatric services?
For the sales and marketing teams, that one actually, I think, is going to be a little bit more tricky. Again, you're going to have to look at the scope of duties of the sales and marketing folks. Obviously they are not on site, but it's really not telework. So on those circumstances, that's actually a really good question. I would say you probably need to have those. First of all, if they're an employee of a certified agency, they need to be vaccinated unless they're doing full-time telework or they're one-off, individuals. So I'm assuming that they're employees and they're not one-offs. So in that circumstance, then yes, they need to be vaccinated. If this is a contracted marketing agency, then they still need to be vaccinated because, again, the requirement under the interim final rule is that even contracted entities, if they're working at the facility or directly with patients, they need to be vaccinated. The other thing is sales and marketing staff are likely going into facilities that have vaccine requirements. And so if you have staff going into those facilities, then you may have to comply with those individuals' vaccination requirements. And again, if you're going into facilities, I'm going to make the assumption that most of those kinds of facilities or providers, doctors' offices and so on, do get Medicare. And so they will have to have compliance with the vaccine requirements as well. So I think I'm coming down to, as I'm talking my way through the thought process, sales and marketing staff, I think you probably should have them vaccinated. For LHH pediatric, if you're not Medicare or Medicaid certified, then the CMS rules do not apply to you if you're licensed only by the state. So there is no requirement. I'm going to just put out there a question as to whether or not you end up having a policy anyway, depending on on what your patient population is. Obviously, if patients are immunocompromised and you're dealing with some very, very sick patients, then as a privately owned agency, you can implement a policy that requires that. Or you can have masking requirements. So I think that requires a little bit more consideration of things like, again, what your patient population is, and demographics, where you're located. You may want to think about, again, pushback or feedback that you get from those you are servicing. So I think there's a lot of recommendations. Again, no requirement that an LHH pediatric services provider comply with the vaccine mandates, but this may be one of these cases where, even though it's not a requirement, discretion may be the better part of valor, and you might decide you want to go ahead with that anyway.
Perfect. Thank you so much, Heidi. We actually have 2 more questions. This seems to be a really helpful topic for a lot of people. Can patients ask to receive care only from vaccinated personnel?
Oh, that is a great question. I think that is a valid concern, and I think that is a valid request. The problem here is, again, you have to then be cautious that you don't violate any of the other requirements, the EEOC requirements and so on. Vaccination status is not one of the things that is considered a discriminatory or a category against which discrimination is not prohibited. So I think if you are very consistent and cautious about this, I think to the best of your abilities, you should accommodate patient requests. And again, particularly if you have an immune compromised patient, an elderly patient perhaps, having that individual come down with COVID could be not just catastrophic, it could be fatal. So I think in those cases, to the best of your ability, you should accommodate the patient requests. If you can't accommodate those requests, have that individual should reach out to their attorney and very carefully work through and document why you cannot accommodate those requests.
Perfect. Thank you, Heidi. We have 1 more question. Someone is asking, can an exempt team member choose to wear a KN95 mask, or must they be fit tested with an N95?
Can you repeat that for me?
Yeah, no problem. I too I'm not quite sure what they're referring to. Can an exempt team member choose to wear a KN95 mask, or must they be fit tested with an N95 mask?
Okay, so I'm not sure what the individual means by exempt employees. Exempt is usually managerial type employees.
Okay.
So again, I guess I would go back to sort of, again, in Texas, there is no longer a mask mandate. So as long as you have a mask, I think you're probably good at this point, and you can require that. If, as an employer, you choose to do fit testing, I think that's up to you.
Heidi. The individual that asked that question sort of clarified. She said vaccination exempt. I apologize for not being clear. So I think that about it. Yes.
Okay.
So sorry about that. I just saw that.
Okay. So if you have somebody who is vaccination exempted, then you have to go through what the reasonable accommodations for those are, and that can be masking. So whether or not a K95 is sufficient for amounting to a reasonable accommodation versus fit testing, I think is going to be very fact specific. I think they're going to look at what your patient population is. They're going to look at where the services are provided. I mean, are you a facility inpatient and so on? That kind of stuff. So I think that really gets down into the weeds on all of this. I will say that it is my belief, that if you were surveyed and you documented why you chose to go the KN95 route versus a fit tested N95, I think you could probably get by with that if the rest of your documentation in terms of vaccinations is up to snuff and up to standards. So I think this is one of those situations where you really need to sit down and look at all your specific circumstances. And I think you might want to, that participant might want to reach out to their attorney and kind of work through that to make sure that they have the sufficient documentation and answers to those questions.
Gotcha. Thank you, Heidi. So we actually started, while we were answering that question, we got a couple more. So we have one that's asking, what about federal workers' comp providers that are not, neither Medicare nor Medicaid providers?
So we did not approach the federal workers' comp, but again, these vaccination requirements are specifically for CMS. I can check with that person if they want to reach out separately. We'll look into that, but we did not approach workers' comp for the purposes of this webinar.
Gotcha. Thank you, Heidi. We have a bit of a longer one here. This individual is asking, regarding the additional precautions for unvaccinated and exempt employees, can you confirm that agencies must, in all caps, have some sort of extra quote-unquote measures? It seems that if you have any unvaccinated employees, there must be masking or testing or other suggestions, and then they say correct.
So yes, if you have somebody who is not vaccinated and you are relying on something else, then you have to document what it is that you are going to be doing. And there is really no specific recommendation on this. Part of this is going to be a determination that you make, but they are certainly going to look at things like, are you requiring masks? Are you doing testing? Are you doing both? Are you putting people on telehealth? I mean, again, this becomes a case-specific inquiry, but yes, there are additional requirements if you don't have staff vaccinated. So yes, additional requirements. Exactly what those requirements are is going to be a case-by-case analysis.
Perfect. Thank you so much, Heidi. Okay, we have one more question. It seems to be more of like possibly an opinion sort of question. This individual asks, do you feel that the mandates will be removed soon due to not prevent transmission or contracting COVID?
It is my personal opinion that these mandates are not going to be removed soon. Again, when I look at the statistics, there is still a significant amount of COVID circulating in the country. They recently renewed the public health emergency again, which has all the flexibilities for COVID. And I guess one of the things that I always look at is again, the transmission rates and the death rates. And again, I just looked yesterday or the day before, and there's still over 300 people every day dying from COVID in the country. So until those death and transmission rates come down, I do not foresee these vaccination requirements being removed. And then even after those come down, I think what is going to happen is that the COVID vaccination requirements are going to become sort of part of your standard, what's the word I want? Standard vaccination requirements, you know, like kind of like the annual flu vaccine, right? You know, there's some considerations around those as well. But I do not foresee these vaccination requirements being removed. Certainly not before the end of the public health emergency. And, you know, if that gets extended into summer, then I don't foresee these being removed before summer at the earliest.
All right, well, thank you so much, Heidi. I appreciate it. And everyone, thank you so much for attending. That concludes today's webinar. Thank you for joining us, and thank you to our presenter, Heidi Coker. And everyone from today's webinar will receive copies of the presentation slides via email. If you have any questions about today's discussion or another healthcare law issue, please feel free to reach out to Lyles Parker. Thank you so much.
Thank you all. Bye-bye.
Bye, Heidi.